Good morning, everybody. This is Dr. Susan Mara with Dr. Mara's Medical Minutes. And today we're going to talk about MCAS again. And the reason we're going to talk about it is because it's just so prevalent now. There is a difference between MCAS and MCAS syndrome. MCAS syndrome is far more serious. And there's probably a genetic piece to the mast cell syndrome that's mediated by a mutation in the KIT gene, which codes for a protein that regulates growth, cell growth. So MCAS is just really becoming a huge problem for a number of different reasons. I think that the human immune system is breaking down because we are chronically, daily exposed to all these things in the universe that we weren't meant to be exposed to. All these benzenes, all these chlorines, all these, PFAS, on and on and on and on. And I just don't think that our bodies can handle them immunologically, and I don't think they can handle them in a detoxifying way either. So one of the things that happens is there is an activation of an immune cell in your body called the mast cell, M-A-S-T, mast cell. And mast cell has granules in it, and in the granules are histamine. When mast cells get activated, the granules release histamine, and as you know, histamine is a ubiquitous molecule, and it generally wreaks havoc. It increases inflammation, causes allergies, it can make you dizzy, can make you nauseous, you get severe, allergic, just nasty symptoms. You get flushing, hives, easy bruising, itchiness, burning, dermatographia. Dermatographia is actually one of the easiest ways to identify it as a clinician. What you do is you take a pen, not with the point, put the point in, and you ask the person to put their arm out, and you relatively hard, not digging, but hard, draw a line down their arm or on the outside of their arm. And you check to see if there is sort of like a red swelling. If you see a red swelling, then that person is most likely producing histamine and maybe overproducing histamine. So that's what I like to do in the clinic because it's a quick test, and it's very difficult to diagnose MCAS because all these molecules like the leukotrienes, the prostaglandins and tryptase, they're very fragile in the blood and they don't last long. So it's really hard to capture them. Chromogranin A, that's another one. I've never had a patient test positive for chromogranin A. So it's just a very difficult, like Lyme, like mold, it's a very difficult syndrome to diagnose. And the signs and symptoms are all over the place, including anaphylaxis, which is serious. It requires the use of an EpiPen. And, you really need to familiarize yourself with mast cell activation syndrome. And especially if you're working in tick-borne illness and mold and chemical exposure, and now COVID and COVID vaccine, that also triggers MCAS. And you really need to become familiar with it so that you know how to manage it, because whenever you go after these infections, especially when they're polymicrobial, in other words, more than one organism, you've got to deal with the MCAS first, and you've got to stabilize the histamine. Can't be like this all over the place. You'll never get anywhere because histamine is like pouring gasoline on a fire. Just makes it 1,000 times worse. So really understanding mast cell activation syndrome, which we're just beginning to understand. I mean, it hasn't been as big of a deal until the last 10, 14 years. The other thing is that mast cells can cause neuropsychiatric problems. They can cause brain fog, headaches, fatigue and lethargy, lack of concentration, mild cognitive problems, sleep disturbances, and then, of course, respiratory symptoms, including congestion, coughing, and wheezing. So when you see that myriad of symptoms, you should begin to think, MCAS. We might need to start to begin to stabilize the mast cells. So stabilization of mast cells is not an easy thing. It's very individualistic. Some people have to use drugs. Some people require natural supplements. And so you'll just have to pick and choose and figure out what works best for your patients. So I hope you found this information helpful, and I hope you have a wonderful day. Take care.